Hi everyone, my name is Johnston. I work in research at Praxis Care, which is a mental health and learning disability charity based in the UK and Ireland. And over the past 2 years I've been working on and looking at physical design and architecture for specific populations. And so today I'm going to present my scoping review on design, mental health and intellectual disabilities. So I'll just give you an idea of the content and the topics I'm going to cover in my presentation today. I'm going to discuss a little bit about the background literature, design guidelines that I've identified, the scoping review, the findings from the scoping review, key messages, and then some future research. So in relation to the background, people with mental health problems and intellectual disabilities are amongst the most disadvantaged in society, and they're more likely to have significantly poorer health than the general population, experience a range of comorbidities including obesity, diabetes and cardiovascular disease, and so design may be particularly important to alleviate some of these conditions. It's well established that architecture and design of our homes, buildings and cities can impact upon our physical and mental health, and a number of studies have found a link between architecture and well-being. Some of the seminal work conducted by Ulrich in 1984 explored the impact of physical design on outcomes for hospital patients, and this particular study found that a view of nature compared to a view of a wall was associated with reduced use of medication, fewer complications after surgery, and more positive interactions with staff, which is really interesting findings from that. So in recent years, there has been a renewed focus on physical design features of inpatient facilities, including hospitals and psychiatric facilities. And some of the key design features identified for improving quality of life and health outcomes for patients include a community location, a newly designed building, home-like facilities, outdoor and green spaces, and window views. So the background kind of explains why we need to conduct further research. It clearly demonstrates the lack of robust evidence for design of supported accommodation, and we then need to think about how. So how can we design our facilities tailored to the needs of service users? How can we positively impact outcomes through design? And how do we affect evidence-based change? So really, this project had 3 distinct phases where we conducted a context report to set the context for Northern Ireland and for design of supported accommodation in Northern Ireland. Then we conducted the scoping review, looking at design of supported accommodation for people with mental health problems and intellectual disabilities. And then we went about designing a design catalogue where we had all of the key features and design features that should be looked at when we're designing supported accommodation. But today we're just going to focus on the scoping review and the findings from it. So we identified a number of design guidelines, and some relate to the general population, but more specifically we were looking to find guidelines relating to people with mental health problems and intellectual disabilities. And as you can see, actually there were lots of guidelines specifically relating to autism, but there were not a lot of guidelines in relation to mental health and intellectual disabilities. So the findings from these guidelines, the key findings were adaptable features that can be adjusted in a short time without involving structural or finished material changes. Location, so of buildings close to established and stable neighbourhoods, access to public transport, shops and cafes, health services and leisure facilities. A logical building layout to assist with wayfinding for people with learning disabilities, and organising building layout to help establish routines and aid understanding by specifying spaces according to their primary functions. Access to outdoor spaces, gardens and sheltered areas within those outdoor spaces, and then also normal home furnishings to sort of avoid an institutional feel to the place. So in terms of the scoping review then, the aim was to review physical design of supported accommodation for people with mental health problems and intellectual disabilities. And our objectives were firstly to examine the scope of the evidence in relation to physical design of supported accommodation, then to identify physical design features of supported accommodation, and also to explore the impact of the physical design of supported accommodation on the health and well-being of service users and staff. So our search strategy, we searched 7 databases, and we used search terms including supported accommodation, physical design, and then the relevant derivatives of those search terms as well. And no time span limits were imposed, and we hand searched the reference lists of all of the included studies as well. So the eligibility criteria: studies were included if they met the following criteria: conducted in a supported accommodation setting, reported at least one measure of physical design, the mean age of participants was over 18 years, the population was adults with intellectual disabilities, mental ill health and or challenging behaviour, and that the full text was available in English as well. And then studies were excluded if they didn't meet this criteria. So this is our Prisma diagram, which we used to sort of show and record how many articles we identified, screened, excluded, and then the number of studies we actually included in the review, which was only 8 after we had screened all of the tiles. So this table just shows an overview of the 8 studies included in the review. We're not going to look at this in too much detail, but I just wanted to highlight a couple of things. Firstly, we can see that the majority of the included studies came from Sweden. The Swedish are obviously very forward-thinking when it comes to this type of design. So studies included in the review were conducted in Sweden, the USA and Canada, with sample sizes ranging from 17 to 760 participants. The total number of participants across all studies was 1,193. All studies included mixed genders, and as per the inclusion criteria, the setting for all included studies was supported accommodation. And we can just look at some of the key results and interesting results from these studies. So you can see the studies from Sweden. Low quality housing was associated with 28% increase in community-based mental health service costs. Perceived physical and social environment was important. Better housing environments associated with better well-being outcomes. So some really interesting results from those studies. And these were some of the consistent themes throughout the study. So there were 7 consistent themes throughout all of the 8 included papers. And those were location, common areas, private spaces, outdoor spaces, a home-like environment, health and well-being, and social interaction. So what I'm going to do is just going to break down each of these themes and look at some of the sub-themes within them as well. So 4 studies reported on physical qualities of neighbourhoods within which supported accommodation was located. And this included things like amenities, so shops, cafes, leisure facilities were all important to consider. Service users reported wanting to be near all of these amenities. Community accessibility, this was an important consideration when deciding between urban or rural locations. The physical environment of the neighbourhood should possess qualities such as good lighting, footpaths, access to transportation and community accessibility. Neighbourhood quality, so findings also suggest that the physical quality of a neighbourhood has an impact on mental health outcomes, with neighbourhood problems being associated with 26% higher community-based mental health service costs, which is a really interesting finding. Green space, so the findings also showed that high quality supported accommodation was often located in the suburbs, which afforded residents opportunities to access green spaces, whilst low quality facilities were more often in urban locations, which provided residents with better access to community services. So there's kind of pros and cons for the locations. So urban locations have better community access and access to amenities. However, they may be noisy, overlooked, have high levels of traffic. Whereas rural locations, they're more tranquil, there's more green space. However, there may be a lack of transportation links and less access to amenities. So it's really a balancing act when looking at location for supported accommodation. So 4 studies reported on the design and use of common rooms in supported accommodation, and there were 4 themes, sort of with sub-themes within this, and that was that they were open and connected. So thought needs to be given to planning and furnishing of these areas to be more open and connected, allowing users to circulate within these spaces. Natural light as well, so findings suggest that common areas should have as much natural sunlight as possible, as this may have a positive impact on the use of the environment for service users. Leisure activities too, so common rooms were portrayed by participants as places to relax and participate in leisure activities with other service users. And soft furnishings that are home-like and give a less institutional feel to the common area environment as well. 3 studies reported on the design and use of private rooms, and some of the themes here that were important were autonomy. In relation to private spaces, was important for service users to customise their own space. They valued their own space for resting and retreating from others, but also having space for activities including yoga, meditation, watching TV, listening to music and walking around, and moreover the ability to have their own furniture, including a bed, sofa, armchairs. All of those features were important. Retreat, so findings by PIAT 2017 showed that service users valued their own private space to retreat from others. Again, the same sort of theme as autonomy as well. Service users valued their private spaces and having their own front door, their own bedroom, separate kitchen and living spaces as well. And designated space. So I think it was one study that reported that service users valued having a designated space for different activities. So a separate bathroom, separate cooking areas, separate spaces for sleeping and for socialising. And controlling their own environment. So ability to control their own environment was also important, and that was things like controlling the temperature, being able to open and close windows, controlling the light levels within a room, choosing wall colours, furnishings and decorations as well. So half of the studies reported on the design and use of outdoor spaces, and there was 3 sub-themes within this. So a stimulating environment was considered important to encourage service users to make use of space, things to look at and things to do as well within that space. Gardens, trees and flowers as well. Service users reported that the presence of gardens, trees and flowers, a barbecue, areas for privacy would encourage them to use an outdoor space. Therapeutic, so furthermore, service users reported that gardens and outdoor spaces were therapeutic and features such as flowers were calming and healing. And if the area was well maintained, that would also encourage them to use that space. Some of the negative things associated with an outdoor space was if there was high levels of traffic in the area, if there was a lack of privacy and a lack of greenery, and those were all negative design aspects for an outdoor space and might discourage service users from making use of those spaces in supported accommodation. A home-like environment was a consistent theme across the majority of studies, and again there were a number of sub-themes within this, and these are the key ones here. Ownership, so studies found that a homely environment was defined by ownership of certain objects, and that included just sort of daily items such as even a fridge, a television, which sort of personalised a resident's space. So layout, the same spatial structure and layout as a home to avoid an institutional feel. The ability to customise, service users having the opportunity to customise their living spaces with wall art, and planning the walls was symbolic of their autonomy and an opportunity to create their own homely environment. And welcoming, so the study by Johnston and Brunt 2012 suggested that interiors of supported accommodation should create a warm and welcoming environment that is as homely as possible. So kind of repetition of these themes throughout all of the studies is clear. The majority of the included studies investigated the effect of the physical environment or physical design of supported accommodation on health and well-being. And again, there were a number of sub-themes within this. So perception of their environment. Marcheski et al. 2015 found that perceived physical and social environment qualities of supported accommodation accounted for approximately 32% of variation in perceived quality of life. So big variation in perceived quality of life due to service users' perception of their environment. Wright and Clues 2007 found that participants' perception of their housing environment was associated with well-being outcomes, including psychiatric distress, recovery, residential satisfaction, and adaptive functioning. High quality facilities were characterised by clear demarcation between private and common areas, opportunities for independent living, common room facilities, private rooms, and higher environmental quality. And moreover, high quality physical environment characteristics were more likely to be perceived as home-like and foster positive psychosocial processes between the physical environment and mental health. And lastly, there are then social support. So findings also showed that physical environment qualities can have an effect on perceptions of social support, perceived control, and restoration. So lots of potential for the physical environment to really affect health and well-being of service users, I think was clear throughout all of the studies. 5 studies reported that physical environment was an influencing factor for social interaction. Social interactions between service users were most likely to occur in communal spaces, like common rooms or dining areas and outdoor spaces, and then to a lesser extent sort of in passing in corridors. Communal areas can also foster social connectedness and can decrease the likelihood of loneliness and isolation. Furniture placement, interestingly, was also an important predictor of social interactions in all of these areas. So factors such as layout, configuration, movability of furniture, all facilitated social interactions between service users. So interesting that furniture placement is actually really important as well within these areas. And then just to give a little bit of a theoretical underpinning for the topics we've been discussing, they all fit quite well within Ulrich's theory of supportive design. So this theory of supportive design suggested that healthcare environments can alleviate stress and promote wellness if they're designed with 3 core components. And that is that they foster a sense of control, promote social support, and create positive distraction. And I thought a lot of the themes and sub-themes that we've discussed as a result of the findings from this scoping review really fit well within that theory of supportive design. So some of the key messages then from our findings. Architecture and design has the potential to impact upon outcomes for service users. We've seen it as well established that the built environment has impacts on physical and mental health of the general population, but this may be even more important for people with mental ill health and with intellectual disabilities who suffer a range of comorbidities. Collaboration between architects, planners, builders, housing providers, government departments is crucial. Joined up thinking is required to bring about change to housing guidelines, design guides, and to ensure that a balance can be found between evidence-based design and budget constraints. Co-production is key. Service users need to be at the centre of this. Design of our facilities should be tailored to their needs. And I think that this is a really important factor when we look at trying to include service users in designing their own spaces and places that they're going to live. And lastly, autonomy then. So private rooms which support autonomy with opportunities for personalisation, common areas with natural light and homely features, outdoor spaces with greenery and furniture, located in good neighbourhoods with access to green spaces and community accessibility may be successful in improving service users' perception of their environment, which in turn will facilitate recovery and improve physical and mental health outcomes. And there's a lack of robust evidence, and this suggests that we need to conduct further research, specifically in relation to design of support accommodation. Definitely requires further research in this area. Ideas for future research then. Focus groups or interviews with service users to get their views and opinions on important features of supported accommodation. There appears to be a real gap in the evidence for asking service users what design features are important to them. Further development of a specification catalogue which caters for the holistic needs of service users. And I discussed how we had already started looking at a design catalogue and some of the features that need to be part of that when we're thinking about designing supported accommodation for specific populations. Co-production of a physical design intervention involving service users and staff through an iterative process, building on the evidence synthesis in a scoping review, design and feasibility test, a physical design intervention. And then thinking about capturing the planning, designing and building process within services so that we can develop our design features and ensure that we're providing and tailoring our design features to the needs of service users. Thank you very much for listening, and hopefully there's maybe time for some questions throughout the conference. Thank you.